It's always the scary part to figure out if this is going to work. But shockingly, this technology is like really good.
There's pretty much things working
Yeah.
in the building. Every now and then they have to.
How are you?
Good, how are you?
Doing great.
Awesome, literally.
Oh my God. We almost had to break into the food on the drive over here. It smells so good.
Did you get?
Not yet, not yet.
Oh,
You gotta lead the way and we can get some food.
true.
Esme, I have two interns sitting just behind you here. Lindsay from St. Michael's College and Mia from UD. Yeah, they've been helping out together. Yeah. Esme is one of the steering committee members I mentioned. Who happens to be helping with the caucus.
I'm like, Leslie and Kate, they're gonna be just a little late with the committee.
Yeah. Sorry.
But they like, yeah,
I snuck out.
you did.
I mean, we were almost done. They were totally wrapping up like what the next steps were for the budget. Recording in progress.
That's it. What are you talking about?
We've been
Hi,
requested
Sally and Courtney,
to
can you hear me?
recommend,
Hi, Dan.
Okay.
we
Courtney,
were
you got audio? You
requested to
can hear us
name a
okay?
building in the
Great.
state capitol complex after a previous governor.
Oh, I saw
We are
that.
just
And we
now.
decided we really
Folks are
don't want to
starting
be
to trickle into
responsible
the
for that
room.
because we have
There's
lots
some
of other
food here
things
in the corner,
that we
so
should be doing
give
besides
us
naming
about 10
buildings.
minutes or some committee.
So we're
meetings
setting
to
up
go
a
over it,
process
so,
for a commission
just if you
that
can
will name the
hang tight
buildings that isn't
and
us.
mute
Oh,
yourself.
But we still have to spend the
Drop me a
time
text if
to
you
set
need
up the
anything.
details to make sure it's like
That's why.
objective and all that. So we were listening to
So I think we're
Let's see
mostly hearing
around.
another microphone, Dan.
naming
Hard to
of
hear
buildings
you.
in other
Okay.
state
How about if I
organizations.
look up
So,
that direction? Is that
yeah.
any
How
better?
about you guys? What are you working on in ag today?
128, which is accessory on-farm businesses, like figuring out the criteria that makes them exempt.
Can you hear me at all, Sally?
Exempt
Yes,
from.
we're just getting, we can hear the rest of the conversation.
Oh, yeah.
which is-
What
Yeah,
about-
this
are
is
you
just
guys
the whole
gonna be
room mic is on.
Oh, yeah, that's,
So
those are like,
here, I just.
Yeah, station. Thank you.
No.
Oh, sorry, I was just. Yeah, not with a group.
Yeah.
So we're gonna get going. Thank you all for coming. I'm Leslie Goldman, representative from Wyndham 3, which is down the Bells Falls area, and on the House Healthcare Committee. Care a lot about population health and how to improve the health of the population every way we can through every avenue. And we're here as a learning collaborative. That's how I'm seeing it. Last time we heard from Dr. Kraft, he's going to present earlier, and Brian's here. And we also heard from Dr. Levine and
Sally Kraft
And-
and Susan Powell.
yeah, and that was the third person.
Oh, great.
Yeah. Anyway, I appreciate everyone coming. I'm sorry to have my back to you guys. We're going to start with Esme doing an activity. So she said, don't eat. That might not be good.
It just made.
Yeah, otherwise, all right, so Esme.
Okay, let's go. I'm so excited to be here with y'all, and now there's no turning back. I coach third grade lacrosse for girls, and so I'm gonna incorporate some of those activities.
That's so great.
Well, we're gonna do a little health promoting activity, which is absolutely optional. And you can modify it in whichever way you'd like. But I would encourage you to just, in general, I think in the legislature and whatever we do in our very heavy sitting jobs, we do a lot of thinking and we do very little moving. Oh, I love it. I love it. And so I think one aspect of that too is that we don't pay attention to what we're feeling. We just kind of zone it out so that we can just get the job done, whatever we're doing. So I'd encourage you throughout the process to just like breathe in and just sense like where you're feeling messy and where it could use a little more attention. But that's just word of encouragement to carry with you throughout the rest of your day. One thing I like to do with my girls, my third graders, is a countdown exercise. And we only have like 2 minutes here, so I'll give you like a sneak preview and maybe we won't get through the whole thing. But if you have a chair, just push it back a little bit so you have some space. Because you're going to want either table access or maybe a ledge, access to a ledge that you could lean up again, because we're going to do some triceps. So getting started, we're going to do a countdown starting from 10. And so with 10 calf raises. So really squeeze and reach the top of your tippy toes. 9, 8, 7, 6, 5, 4, 3, 2, 1. And now we're going to switch body parts to focus on. And we're going to do tricep dips. Has anyone done tricep dips before? I've tested the tables and they're like relatively stable, but that I honestly would feel better about. And nobody signed a waiver, so just be careful. If you can't, you also don't have to find a spot. Oh my God, that's so precarious. And try to do 10 if you can. Alternatives is you could just stretch if you want. Okay, let me see what my third exercise was. I don't even remember.
I'm really feeling my inner 8-year-old. That was a good year. It's third grade, right? That's a third grade.
Okay, and another challenge here. This one you can do in a subtle way or a more dramatic way, depending on what you're thinking. But find a chair, a comfy chair, and you might want to sit sideways so the arms or the back isn't blocking you. But kind of balance your center of gravity in the middle and do a V-up, and you can hold on to it for support. Yes, Carol. Or plank.
Nice. I don't have any.
As an alternative, and this one you can do in committee, but try to have really good posture and just lift your leg a little bit up off the chair and hold. All right, we're going down. So 9 calf raises. 9, 8, 7, 6, 5, 4, 3, 2, 1. 9 tricep dips. 1, 2, 3, 4, 5, 6, 7, 8. I'm gonna go on. I encourage modification. And then let's do some of these. 2.
I didn't get to do my sit-ups. Come on.
Okay, we're going down. We're going down. Are we on 8?
7.
6, 5, 4, 3, 2, 1. Tricep dips. 7, 6, 5, 4, 3, 2, 1. And we're back here. 7, 6, 5, 4, 3, 2, 1.
I don't see the people on Zoom.
I see one.
What do we, oh, sorry. Yeah,
Maybe 5,
yeah.
3, 2, 1, or something like that. We can skip too.
Yeah.
You get the gist. Oh, I'm mixing it, but
Oh, yeah.
let's do 2 more rounds and then we'll be good. But then I have one last bonus exercise. It'll be very brief.
This is torture with this plate of fruits. I know. I need to take a bite. Oh my God.
I'm so with you.
Yeah, I'm happy to.
Okay.
But I don't.
Last thing I want you to do is find a wall.
Morning and did it.
Did you?
And then find your buddy who's standing next to you. Wanna be buddy? I'll go back and show.
This is your Helen.
Okay,
Come on over, Leslie.
and I want you to try to get a 90-degree angle between your legs and the wall.
Yeah.
I want you to look at your partner and I want you to tell them something that made you smile so far today.
And
Are you feeling it?
Yeah.
I'll have a word for you.
Yeah.
I may, if we,
Okay, if we do the screening thing up.
Yes, that's great. Good.
And shake it out and good job, guys. Thank you for indulging me. Good job.
okay, next on our agenda. I hope everyone has food. It's fantastic. Have seconds, there's plenty. All right, so the next step on the agenda is to go to Dan Olson, who is the Executive Director of the Vermont Public Health Association. And those of you who were here last time, we had cards, and that's what these cards are, who many people wrote questions on, and he has sorted them into themes. So we want to keep expanding our questions and themes. So please fill out something today and leave it with any of us.
Great.
Dan.
I will keep it super brief because we want to get to our main speakers today, but just wanted to, so when we had asked people for feedback, what would they like to see in the caucus? I think it both reflects a desire from the steering committee to make this responsive to what the legislators feel like they need, and also to take a slow, thoughtful process to what content we engage with. So a few themes that came from the cards, I'd say there's almost 3 different categories of interest. One is, specific issues. So environmental toxins or the health impacts of climate change. I kind of think of those as topic or issue specific deep dives. The other I would say is a macro level framework. So the economics of prevention, how can we think big picture about broader framing of public health and how it can be presented to the legislature. And then last, there was definitely a category of bigger picture healthcare system improvements. So topics like single payer system or expanding access to primary care doctors. So anyway, just some themes that have started to emerge, but please do, if you have a card in front of you and you need a pencil, there's a couple of pencils floating around. Please continue to share your thoughts of what you'd like to see from the caucus, as this caucus is really here to serve the legislature and what it is you feel like is going to help empower you to make better decisions. So thanks everyone for your input.
Doing, but sorry.
Oh, yeah.
I have to say what came out of this first moment for me was Esme, let's talk about how we can integrate what we just did, something like it in our committee. In a way, because it changes our biochemistry, right? And it resets our brains, and it's a really good thing. So I think this might be a first thought. I'll write that on my card.
I'm going to write it on my card too, because
Yeah.
I think that we have to incorporate healthier habits into our days.
And I've learned, I'm part of a study on brain health. I keep learning new things, but one of the things I learned was every hour of focus, you have to have 5 minutes of a break.
Interesting.
And then your brain really takes in more and everything else. And I do think that we just sitting is tremendously unhealthy when you do it for hours at a time, which we do. So I think that maybe we could do this for ourselves. That doesn't involve expense.
And start close to home, which is great.
Yeah,
'cause that's
instead of telling everybody else what to do, we should do it ourselves.
That's right.
And even without any sort of policy change or operational change, just having little brain tools at your desk as you're talking through policy, little tools can help the way that you think through and make your decisions, get your brain to do some of the flow. I think gives you more creative structure for thinking as you make decisions or prioritize your budget stuff.
Oh, I love that. Daisy and I are on the same committee as Bobby, and we've been.
And Melanie.
And Melanie, of course. Yeah, and so we've been working really hard. It's been really hard. But we are, as one, our committee came together after all that work.
Squeezy buses. Good. I got a cube from the Department of Forest Parks and Recreation. I should have gotten one for everyone. My little fidget spinner in my hand.
That's Anyway, let's go on. We have two speakers today, Dr. Sally Kraft and Courtney Tanner, who's a social worker, and their bios are both on our agenda, so we didn't want to have to repeat all that. You can read it if you're interested. So let's go straight to that.
Great, good morning, good afternoon. I'm Sally Kraft and Courtney.
Good morning. Good afternoon. I did the same thing, Sally.
We're on the same wavelength, Courtney. We were invited to come and share a few ideas, particularly related to the political determinants of health. And we've got just a few slides. I think Courtney, well, I know Courtney, both Courtney and I are far more excited about discussions and engaging conversations than we are about showing PowerPoint slides. But just to sort of level set, we'll start off with a few slides to give you some background, and then we're going to open this up and see how we can be helpful to you. So Dan, if you can go to the first slide. So my apologies if those of you in the room have already seen this slide. I can't remember if I used slides when I was here a while ago. But
No, you didn't.
okay, good. Well, I did speak to this slide. So now you've got a picture that goes with it. So here we are, beautiful stream in Vermont. And we talk a lot in our population health work about how do we organize this work to improve health equity. And when I talk about population health, I'm really talking about the public's health. And this is the outcomes of a group of people, the health outcomes. So it's more than just healthcare delivery. And frankly, it's more than just public health. It's really that entire equation of healthcare services and structures and systems that support or detract from health. So it's all of those. And we talk a lot about population health, the health outcomes of a group of people, and the distribution of those outcomes across those group of people. That phrase, the distribution of outcomes, is equity. Does everyone have a fair and just opportunity to be as healthy as they possibly can? And this is a really complicated topic. It's complicated because there are many pieces that are involved. And frankly, it's hard to even get organized in your mind. How do we even start to pull the pieces apart to create deeper understanding, shared goals, and to coordinate and align efforts across multiple sectors in our communities to achieve improvements in health equity and health outcomes? So let me share with you a model, just a very simple model built on a Vermont stream. Downstream is where the patients come to the hospital, to the clinics. This is where care is delivered, health care services. Healthcare services are important. When I show up in the ED with chest pain, please do not talk to me about eating apples when I was 10 years old. What I want you to do is put a bloody stent in and save my life. So healthcare services are really important, but all of you in this room, because you're in the Public Health Caucus, recognize that healthcare services are only probably about 10 to 20% of the overall impact on health outcomes. But we've got to get the healthcare services right too. So how do we transform our healthcare delivery systems to provide consistent, reliable, equal access to healthcare for all persons, and to screen and to understand our patients' health-related social needs? Because when they go out the door, they're having to go back to live in conditions that in the past we never asked them about. Do you have access to transportation? Are you employed? Are you getting beat up at home? Do you have a refrigerator? So when I write you a prescription for insulin, you can put your insulin in the refrigerator. That's downstream. Midstream, what is the work that we are doing as a community and in our healthcare systems to connect our patients and our people to the assets and the resources that are available to them in the community? So many people live in communities where there are truly resources, but they don't know how to access them. How do we help navigate and make those connections? And then upstream, where we're really going to spend our time today, is to talk about the social drivers of health and the policies and the payment models and the regulations that impact those social drivers of health. When I talk about social drivers of health, I'm talking about housing, transportation, access to nutritious food, employability, education, availability of childcare, all of these things that shape our health. Next slide, please, Dan. What does this look like? At Dartmouth Health, if you come to see us in the primary care clinic down in the, I'm looking now at the lower left-hand corner. If you come in to see us in primary care, we're going to screen you for your health-related social needs. We'll ask you if you're hungry. We'll ask you if you have access to transportation. We'll ask you if it's hard for you to fill out forms, health literacy. We're going to ask you about those health-related issues, health-related needs that we know are going to impact your care. If you identify that you have needs and you identify that, yes, I would like help, we can connect you to a community health worker, or we can hand you a resource page, but we'll work on helping you make those connections with resources that are available. And then upstream is where Courtney does her work, and where population health and our government relations partnership has really created what I think is very, very exciting opportunities. How do we understand proposed legislation, understand the health impacts, and how do we advocate for policies that are going to improve and promote excellent health outcomes? We also work in our population health team on anchor institution strategies, which is a talk for another day. But let me just say that our hospitals are almost always the major employers in communities. And through the intentional business decisions that are being made, where do you hire? Where do you purchase supplies? Where are you investing dollars? You can have an enormous impact on the health and well-being of a community. Next slide. Courtney, do you want to do this slide, or?
I'm happy to have you do it, Sally. I'm here when you want me to jump in.
Oh, okay, I'll go quickly. Social determinants of health. I don't like the term. I use the term social drivers. I'm actually stunned that I wrote social determinants of health. These things don't determine your health. They influence your health or drive your health. And you all know this. I'm sure everyone around this table knows this definition. The conditions in which people are born, work, grow, live, and age. So my question to you is, why? What shapes those social determinants are social drivers of health. Next slide. And I think this is where, oh, one more back, Dan. I think this is where we want to spend a bit of our time today, is talking about the political determinants of health. If you go back to that Vermont stream, I'm going all the way upstream to that spring that first starts the water flowing. The political determinants of health create the social drivers, those social drivers of health that affect all the other dynamics of health. Somewhere upstream, decisions were made to divert the water to benefit certain people and harm others. And decisions were made to place certain types of people on specific banks of the river while placing others elsewhere. Redlining practices, decisions that were made by legislatures long ago and policies long ago about those dark people don't live here. White people, you get to live here. These social conditions of health are rooted in the political determinants of health. Courtney, I'll turn it over to you, and Dan, next slide.
Sure. So it's nice to meet you all, and virtually. I know Sally had a chance to meet everyone last time she was here. I serve as the Senior Director of Government Relations at Dartmouth Health, and I am the registered New Hampshire lobbyist for the Dartmouth Health system. So I don't spend as much time in Montpelier, although I do try to get over there once a quarter. We have a contract lobbyist that represents Dartmouth Health in Montpelier. So I love spending time in your downtown. I do shop for baby clothes when I'm downtown there. So you've got a lovely downtown. So, but I spent a lot of time in Concord, and so you'll forgive the slide. This is a new snapshot of New Hampshire. And as Sally noted, there are, we know that policies that you all promulgate and that the executive branches promulgate impact our ability to deliver healthcare, our ability to have the resources in the community that are needed. But we also know that there are a number of players who impact the legislation and the executive action that happens. So again, forgive the slide, these are New Hampshire players, but you have similar players in your state. The insurance carriers, the hospital association, social workers, don't forget pharma. And we also have to think about the other side of the equation, patient advocacy groups. So in New Hampshire, we have an organization called New Futures. Both states have NAMI New Hampshire. So those patient advocacy groups that are really bringing consumers to the advocacy conversations. And I would just, I'm really looking forward to rolling up my sleeves, but and talking with you about specific legislation that you're thinking about. But Vermont's made a lot of investments in increasing access to healthcare. But I also would encourage you to think broader than that. Just last year, Vermont passed a really innovative childcare access piece of legislation. And so we very much see that those types of social supports advance the health of our communities. And as I said, as a mom of a 6-month-old and a 4-month-old, childcare is so important. Next slide.
4-year-old, Courtney. You said 4 months.
Oh, I'm sorry. 6 months and 4 years. 6 months and 4 years. Yes.
I knew you were a miracle.
No, not that close.
I'll just jump in and just tell you how some of this got started, this focus on the political determinants of health. And then I'm going to turn it over to Courtney to really walk you through what we've done at Dartmouth Health and start the conversation. When COVID-19 came, all of us, of course, were taken off guard. But what we really found out that we were focusing on, as much as getting masks on people and wash your hands and how do we set up remote work, we found out that we really got pushed, we being population health, to really start to address the policies and the mandates that people were talking about. And I'm not I'm a doctor. I don't do policy work. Thank God for Courtney. But I quickly realized that if I needed to implement public health measures and interventions in the clinical and in the community area that were going to, I thought, and I still believe, protect our peoples and protect our public's health, I had to very quickly learn how to move in the advocacy and policy space. The whole debate on vaccine mandates. Do we require people in healthcare systems to have a vaccine? Work related to the Public Health Emergency Act. How could we redesign, how will we redesign care given some of the policies that were enacted? And in particular, I'm sure all of you are thinking about the absolute exponential increase in access to telehealth. How do we keep our students safe? Do they go back to school or not go to school? Who needs to be vaccinated? Wonder if you're unvaccinated. How do we deal with school COVID breakouts? How do we help educate employers so they can keep their doors open, keep people employed, and keep goods and products on the shelf? All of these things that normally a doctor, an MD, has nothing to do with, and quite frankly, an MPH, a public health official, may not have that much schooling in. I certainly didn't. We really rapidly needed to work with our policy colleagues and our advocacy colleagues on how do we advance policies that will do the very best possible at the state level as we're reacting to federal policy, but also within the state and the region and in our own organization, so that we could optimize the chance of keeping everyone as healthy as possible. This meant working in partnership with public health teams, as well as working in partnership with community-based organizations and basically busting down all the silos in the past that kept us from working in concert together. So this was really our first push way upstream. And I'm going to turn it back to Courtney to talk about some subsequent work that grew from this.
Yeah, so what really came out of this was, as Sally noted, we saw a number of, I think at that point we were facing 100 bills in New Hampshire that would have prohibited vaccine mandates, would have prohibited schools from implementing public health measures around COVID-19. Really what we saw as a detriment to our ability to respond to COVID-19. And so Dartmouth Health is the only academic medical system in the state of New Hampshire. And we said, what should we be doing to address, inform the public and be a part of the conversation in a meaningful way, aside from the government relations office and the lobbying work that two people on our team can do? What should we as a system be doing? And so we stood up and implemented the political determinants of health ECHO. You can see I left my back screen up because we just had our first ECHO yesterday. We launched this in 2022, and what this ECHO is a virtual platform that we spend half of the ECHO with an expert. So we figure out topics that we're going to discuss in advance, and we bring an expert to that ECHO session. And the expert presents. And so an example of this might be the importance of a vaccine registry. I know Vermont has a vaccine registry and it's well implemented, but New Hampshire just implemented its vaccine registry. The timing was terrible because we were on the heels of COVID and we were experiencing political backlash, but we were the last in the nation to stand up our vaccine registry. And so we might have a provider that comes and talks about what a vaccine registry is, how that's important, what that does for public health infrastructure. And then we open the ECHO up to questions and we discuss, current legislation. We present on bills that might potentially impact that vaccine registry. And we had, Sally, you'll be so happy to hear that for this year, we have over 200 registrants for our ECHO, our political determinants of health ECHO. And we had 98 participants yesterday, so almost 100 participants that are interested in what's happening in New Hampshire. We focus our echo right now on New Hampshire legislation, but the model is ripe to be spread to other states. Go ahead, Dan. Next slide would be great. So this was what we covered last year. We talked. It was a budget year for us. And so we covered the state budget a few different times. As you know, the state budget is it's a bill, it's a legislative bill, and it's a policy. And in the budget, there are key provisions to help us deliver healthcare and social services across the state. So we did spend a couple of sessions on our budget. But we also looked at things like Medicaid redetermination and eligibility, which we're seeing the impacts of redetermination now for good or bad. We focused on maternal health legislation. It took us a couple of sessions to get expanding Medicaid coverage for the postpartum population across the finish line in New Hampshire, but we did it. We also in New Hampshire had to reauthorize our Medicaid expansion. Nowhere else in the country do we have to do that, but in New Hampshire we do, because we have to do things a little bit different. So our Medicaid expansion sunsets, and so we did talk about that. Of course, housing is an issue on both sides of the river. And we spent some time thinking about continuum of care. So are patients getting the right care at the right time? And I definitely want to talk a little bit about that before Sally and I leave today. We talked about energy and the environment, climate change and its impact on health, and of course, childcare and children's health. We couldn't move away from that without talking about the importance of that. We're still experiencing a childcare crisis here in New Hampshire. We don't have enough childcare for our need. Next slide. So I would love to open it up to questions and discussions. I am sure as a new caucus, Sally shared some of the work that you're doing, and I hope that I have it right that you're the first public health caucus in the country. I'm not surprised by that coming out of Vermont, really innovative and it's exciting work, and would love to hear from you about what you're thinking about for priorities and where you want to see your caucus focus its work over the next year, 2 years, 5 years. Some issue areas that we're thinking about really intensely at Dartmouth Health are rural health. And we know we have an aging patient population and we're losing our workforce, or our young workforce is shrinking. And so how are we going to be balancing the supply and demand and our ability to care for an aging population? In that rural health, we have a unique infrastructure needs. So thinking about things like broadband, and what do we really need to be able to meet the demands of this population? With that aging population, we have a increased public payer mix. So we're seeing less commercial payers and more Medicaid and Medicare.
So
And
I'm gonna,
Please,
sorry,
go
I'm
ahead.
gonna,
Go ahead,
yeah,
Leslie.
we're sort of running out of time here, which is too bad, but it means that there's a lot to talk about.
Sure.
I think it would be great for me, there was a citation from JAMA, the Growing Influence of Government on Population Health in the US. If you could send that to Dan, I think I would love to read it. I don't know if others might be interested. We could certainly send it out. So that was one thing that came up for me. We were planning to end at 12:50, so we're like now, which I'm sorry to say, which says, there's a lot more to talk about than we ever have time for, which is always true. It's Friday afternoon and people have to go back to committee, and then many of us get to go home. So that's really great. Looking for that part as well. Please, thank you, Sally, and thank you, Courtney. I'm sorry to cut you off, Courtney.
That's
Are there
okay.
any final words that you want to just summarize for us, since I did cut you off?
No, that's okay. That we're here to be a resource for you, and thank you for having us today.
I do have a question for you. Do you have a counterpart at UVM or someone connected there?
Yes, very much so. We work
That would be
closely.
really good information. I'm not sure who that is, so I would love to know that.
Sure.
So we can make, oh, I'm sorry, go ahead.
Jason Williams, and he
Okay.
has a small team. Yep.
Okay, know him. Sally, Sally, you still there? Do you have a counterpart in Vermont in the population health world, do you think?
I do. I have not, there has been some turnover in the last couple of years, so I have not established a relationship with this person. But I've heard that Dr. Natasha Withers is the person who is doing some population health service work for UVM.
Is that WITHERS?
Might be WHIT.
Oh, well.
HERS. I don't know. I don't know. Sorry.
Okay. Is there a way to find out? Maybe you could send to Dan or something? That would be great.
Yeah, she's at
Or I don't
UVM.
know, Courtney, if you could, I guess I could contact Jason too. That would be another pathway. All right, that's great. It looks like people are leaving. I just want to ask you, please write questions on the cards. If you didn't get a chance to, send them to me or any of us, because we're interested. And our next meeting is on March 22nd. We are evolving. This is so brand new that we go from meeting to meeting as we come together. If anyone wants to join us in planning and thinking, we love that. So stay in touch and hopefully we'll see you on the 22nd.
Yeah, I would say like, if you have questions or suggestions or like what you want to get out of this, like check in with one of our steering committee members, also, because that's really helpful, because I think, yeah.
And I want to thank students, interns, all guys. That's not the right word to say. All you people, all you humans. I don't mind being a guy in that case. So anyway, thank you all for coming. And thank you, Courtney, and thank you, Sally, for taking the time. I know we'll be in touch again as we proceed. I'm not sure if you're willing to share your slides, but there was a lot of good information that would be helpful. So thank you.
Thank you.
Thank you.
Thank you.
Yes, yeah.
Thank you.
Used to hear.